Hello, welcome to the Basic Food Safety class, presented by Public Health Investigations. First, let's discuss why is food safety important. Food safety is important to prevent food and drinks from becoming contaminated with harmful germs, often called pathogens, and other things that can make people sick. Food safety is important because we want to make sure our consumers are not getting sick from anything that we serve. What we will cover: good hygiene. We want to make sure that the people serving food are practicing good hygiene to prevent any kind of pathogens or bacteria from being passed through food to our consumers. Time and temperature control. Ways we can keep food safe. Safe food storage. And cleanliness and sanitation. What is a foodborne illness? Foodborne illness, also known as food poisoning, is caused by consuming contaminated food, beverages, or water, and can be a variety of bacteria, parasites, viruses, or toxins. Many of these pathogens can be acquired through more than just food, beverages, or water. Top 5 foodborne risk factors: poor personal hygiene. People coming to work sick or not washing their hands is one way we can spread foodborne illness. Improper holding temperatures. We want to make sure we keep foods hot or keep foods cold. Improper cooking temperatures. We want to make sure we cook food to the proper temperature to kill any kinds of bacteria or pathogens. Food from unsafe sources. All the food that we prepare, we want to make sure that we're getting it from approved sources to serve to people. Contaminated equipment or cross-contamination. Making sure all equipment that we're using is clean to prepare food. 3 food hazards. Number 1, biological. Pathogens such as bacteria or viruses, as we discussed, can be spread from food handlers through food to consumers. Physical hazards such as metal, plastic, or glass. If we break a glass in the bar, it could get an ice into a drink that we serve to people, or a staple from a produce box could end up in a salad. The third hazard is chemical. Any kind of detergent, bleach, or cleaner. We want to make sure these things are properly labeled so they not end up in any sort of food we serve. Cross-contamination occurs when food comes into contact with a hazard and becomes potentially dangerous. Pathogens can spread from unwashed hands, dirty surfaces and equipment, other food, and people. They also can spread from pests such as insects, mice, rodents, and cockroaches. A good example of cross-contamination would be if you were cutting raw chicken on a cutting board, and immediately following you began to cut up lettuce that would be used for ready-to-eat salads or sandwiches. Pathogens or bacteria from the chicken could still be present on the cutting board and could pass on to the lettuce that is used in a ready-to-eat food. That is cross-contamination. In this section, we'll discuss personal hygiene and ways we can prevent spreading bacteria or pathogens from people to food. Personal hygiene. The people serving food, we want to make sure they're wearing clean clothes, no jewelry. We want their fingernails short and clean, and we want to make sure we wash our hands. Jewelry and long fingernails could harbor bacteria that could spread to food and make people sick. How to wash your hands. We want to remove single-use gloves. We want to wet our hands with warm water at approximately 85 degrees. Next, we want to apply soap. We need to scrub our hands vigorously for 20 seconds. We need to rinse our hands. We need to dry our hands. And we should be using a paper towel to turn off a faucet to prevent any kind of recontamination of our hands. When to wash your hands? The simple answer is all the time. But here are some specific examples of when we need to wash our hands. Anytime we're coming in from the outside, after we disposed of trash, before we work with any kind of equipment or food, before we place gloves on, anytime we change task, anytime we switch from raw to ready-to-eat foods, after cleaning or using chemicals, after eating, drinking, or smoking, after touching your face, hair, or clothing, after using the restroom, and after handling any dirty equipment. So when should we wash our hands? All the time. In your facility, you will have multiple sinks. Each sink has a very specific function. Hand sinks are to be used only for washing your hands. You should not wash your hands in any other sink that is not a designated hand sink. You do not want to dump anything in the hand sink or use a hand sink for any types of food preparation. The produce food preparation sink should be used to wash produce, thawing any food, cooling any food, and any other food preparation. The 3-compartment sink has a specific duty for washing wares. The first basin shall be used for washing. The second basin shall be used to rinse. The third basin shall be used to sanitize our wares. After that, all wares should be left to air dry. In conclusion, each sink has a very specific duty and must be used only for that duty. Ready-to-eat foods. Ready-to-eat foods are foods that will not be cooked or reheated. With ready-to-eat foods, we want to avoid any bare hand contact. We want to make sure we change our gloves when switching from a different task to handling ready-to-eat foods. And we want to make sure that we are not washing any single-use gloves before touching ready-to-eat foods. Eating, drinking, using electronics. When we're working in a food service facility, we want to make sure that we only eat in designated places. We want to avoid eating where any food preparation is taking place. We want to store any employee food away from consumer food. We want to make sure we clean and sanitize any point of sale systems to make sure that we're not spreading any bacteria or pathogens amongst employees. We want to make sure we're not using our phones while we're preparing food. And we want to make sure we're not wearing any watches. Phones and watches harbor bacteria, and we want to prevent that spread to any food. One way we get people sick is from having sick employees prepare food. If you're feeling sick, you need to let your manager know if you're experiencing the following symptoms: vomiting, infected sores, diarrhea, yellowing of eyes, sore throat with a fever. In addition, there are certain reportable illnesses that if you are diagnosed at a hospital, you must report to your manager. They are norovirus, hepatitis A, Shigella, E. coli, and any form of salmonella. Time and temperature control. There are different ways we can keep people safe. The main ones are time and temperature control. Some foods need temperature control to stay safe. We need to keep cold foods cold and hot foods hot. Otherwise, they offer a moist, nutritious environment for bacteria to stay safe and multiply. Unsafe temperatures for too long allow bacteria to multiply and make people sick. When we're talking about time and temperature control, there are foods called TCS foods that must be kept under time and temperature control. These foods include meat, eggs, dairy, cooked plant food, vegetables and grains, any kind of cut melons, tomatoes, and leafy greens, seed sprouts, and fresh garlic and oil. All these listed foods must be kept at the proper temperatures. So, when we talk about keeping foods at proper temperatures, what are those temperatures? When we need to keep foods cold, Foods must be kept at 41 degrees Fahrenheit or below. And when we need to keep foods hot to prevent the growth of bacteria, they need to be held at 135 degrees Fahrenheit or higher. The zone in between 41 degrees and 135 is called the temperature danger zone. And in that zone is when bacteria begin to multiply exponentially and can get people sick. If we are unable to keep food at the proper temperature, another way to ensure food is being served safely is to use time as a public health control, also known as the 4-hour rule. If we can't keep food at the proper hot and cold temperatures, we can safely serve it for 4 hours. At the end of 4 hours, the food must be disposed of. Food thermometer. A food thermometer is one of the most important tools that can be used in a kitchen. When we use a food thermometer, there's a certain type that makes sure food is at the proper temperature. We want to use a probe thermometer so that we can measure the thickest part of the food. When we're taking temperatures of food, we want to measure multiple areas to make sure the entirety of the product is at the right temperature. First thing we want to do is clean and sanitize the thermometer. We also need to calibrate our thermometer regularly in ice water to make sure it is working properly. If we use a slurry of mostly ice and a little bit of water and insert our probe thermometer, we should get a reading of 32 degrees, and that shows us that our thermometer is working properly and we can use it to check the temperatures of our food. Receiving food. We want to make sure that the food we receive is safe to serve to consumers. So we want to make sure we purchase food from an approved source. We want to inspect that food upon delivery. We want to check for dented cans, any kind of moldy produce or meat. We want to verify the temperatures of TCS foods. It's important that when the food is delivered to us, it is at the proper temperatures. We want to refuse or isolate damaged products. So as we're inspecting our delivery, if we come across any dented cans or any kind of moldy product, we want to remove that from any products that will be used to sell to the consumer. If we're a facility that sells shellfish, we want to make sure we're holding on to the tags for 90 days. Thawing. When we're thawing food, we're taking it from a solid frozen state to a liquid of a soft one because of an increase in temperature. When we thaw, we want to make sure we do it in a way to prevent any sort of foodborne illness or growth of bacteria. Best thawing practices would be under refrigeration, in running water that measures 70 degrees Fahrenheit and below. We also can thaw in a microwave, but food must be cooked immediately. Ready-to-eat foods should not rise above 41 degrees when thawing, and we can also thaw as part of the cooking process if food is frozen, such as putting a frozen burger directly onto a grill. As we discussed earlier, it's important to make sure we cook food to the proper temperature to kill any bacteria that may be present. When we're cooking food, any kind of chicken, turkey, duck, goose, stuffed meat, poultry, fish, and pasta, and also our reheated foods, must be cooked to an internal temperature of 165 degrees Fahrenheit. Any kind of hamburger, ground meat, meatloaf, eggs that are held for service, or ground fish must be cooked to 155 degrees Fahrenheit. Any kind of whole muscle beef, for example steaks, any kind of lamb, veal, pork, or ham, fish or shellfish, or eggs must be cooked to 145 degrees Fahrenheit. As we know, some consumers prefer some foods undercooked. If we do serve food raw or undercooked, we must have a proper consumer advisory and a disclaimer. Once we have cooked food, if we are not serving it immediately and we're keeping it hot, there are certain rules we need to follow. We only want to use equipment designed to hold food. We want to frequently use the thermometer to check the temperature. We want to regularly stir the food to make sure that there are no cold spots in the hot food. We also do not want to mix any kind of fresh food with foods that have been sitting held for a long time. Cooling. Sometimes we make lots of food and we need to cool it down to a proper temperature before reheating it again to use for service. When we're cooling foods, we want to cool in 2 stages. The cooling clock starts when the food hits 135 degrees. We have 2 hours to go from 135 to 70 degrees. Once we've reached 70 degrees in those 2 hours or less, we have 4 hours or less to go from 70 degrees to 41 degrees. Proper cooling methods include using an ice bath. The ice bath should be at the same level as the product, stirring frequently, and also using ice wands. Cutting dense food into smaller pieces to ensure proper cooling, such as lasagna. We can divide food into smaller portions, putting a large batch of soup into smaller containers. We can place the small containers of food into a refrigerator or freezer with enough space around each container to allow airflow. We want to leave food uncovered until it reaches 41 degrees, so that way any residual heat in the product could still escape while it's cooling. After we reach the temperature of 41 degrees, we need to cover to protect from any contaminants. After we cool foods and we need to reheat them for service, there are also rules to follow. We have 2 hours to reheat any foods back up to 165 degrees. Any food reheated in a microwave shall be heated to a uniform temp of at least 165 degrees. Any kind of ready-to-eat, commercially processed food shall be heated within 2 hours to 135 degrees. So if we have a can of nacho cheese, a can of pasta sauce, we only need to reheat those to 135 degrees. If we're making the nacho cheese or the pasta sauce in-house and we've cooled it down, we need to reheat to 165 degrees. In both those scenarios, you have 2 hours to reach the proper temperature. Food storage. After we receive our food, we want to make sure that we're storing it properly. Cold food should be stored at 41 degrees and below. All food not in a waterproof container should be stored 6 inches off the ground in coolers and dry storage areas. When we're in the cooler, the way we need to properly store foods from top to bottom are going to be ready to eat foods on top, any kind of fish and eggs, any kind of beef or pork, ground meat, and chicken on the bottom. In the next portion, we'll be looking at cleaning and sanitation. Sanitize versus disinfect. Sanitizing kills bacteria and should be used on food contact surfaces like dishes, cutting boards, food prep tables, etc. Disinfectants kill bacteria, viruses, and should be used on non-contact food surfaces like doorknobs, display cases, etc. When do we want to clean and sanitize? Anytime we are switching tasks, anytime something becomes contaminated, and at minimum, every 4 hours. Sanitizers. There are many types of sanitizers. The most common ones we see are chlorine. Chlorine sanitizer can be made using bleach. We want to make sure we have test strips that show the chlorine sanitizer measures between 50 parts per million and 200 parts per million. Quaternary ammonium, often known as quat, should measure between 150 parts per million and 400 parts per million. And again, we want to make sure we have chemical test strips to measure the concentration. All food service equipment, including cutting boards, utensils, prep tables, sinks, slicers, mixers, and anything else used to prepare food, must be washed, rinsed, and sanitized. Do not add detergent, soap, cleaning solvents to the sanitizing solution because it will inactivate the sanitizer. Chemical storage. We want to store chemicals away from food storage and contact areas. We want to make sure all chemicals are labeled clearly. And we also want to wash our hands after handling chemicals. We do not want to clean or use chemicals near food. We do not want to mix chemicals together. And we do not want to use a chemical container to store food. Pest control. In a food service establishment, we have everything that a pest could ever want: food, water, and a nice place to live. So we need to control pests in the food service establishment by using a professional exterminator, approved traps, screens, and or fly fans. We need to seal openings so pests can't get in. We need to keep the facility clean. And we do not want to use any household pesticides such as Black Flag, Raid, Decon. These are toxic and not certified to be used in a food facility. Do not use pesticides that do not specify whether they are approved for use in a food facility. Garbage. Pests and rodents feed on crumbs and waste. We always want to maintain a sanitary environment by emptying garbage cans and dumpsters regularly. Keeping your outdoor dumpster area clean can help prevent creating a roadmap from your garbage area to the door of your facility. Imminent health hazards are conditions in a food facility where we cannot operate safely. Imminent health hazards are no hot or running water, a pest infestation, fire, flooding, sewage backup, power outage, a foodborne illness outbreak, and severe cleaning issues. If any of these issues are present in your facility, we may issue a public notice of order to close and close the facility until we can rectify the above situations and make sure that we're operating safely to prevent the public from becoming ill. Partners in Food Safety is a program run by the Health Department to recognize facilities that implement management systems that promote safe food handling operations. These facilities are featured on our website and show people that they are providing safe food for the public to consume.